everyone. I'm Dr. Rendi Murphree, epidemiologist and director of disease surveillance at the Mobile County Health Department. This is sort of a special version of Q&A that we normally do every day on Facebook Live. If you don't follow us on Facebook or Twitter or Instagram or YouTube, you can find us at I Love MCHD, all one word, I Love MCHD. We will, take additional questions there. But we had some people who entered comments and questions on our mchdcares.com website where we provide information about the vaccine. And so we wanted to address those in this kind of one-time event. And then going forward, we will move those questions to our 2:30 Facebook Live update. So number one, are there new timelines for when people between 18 and 64 or with pre-existing conditions will be vaccinated? So the only answer I have for that right now is I don't know. And just to be truthful, we're not sure when we will be able to move to the next level of vaccine eligibility. It really depends on how much vaccine is available to us. And, we'll take the vaccine and use it in the eligibility group that we have right now. And when we think we have saturated that eligibility group and we have enough vaccine to move to the next eligibility group, which would include people with pre-existing conditions, we will do that. These decisions are made by the state health department, and we just fall in step with them. So we know there are lots of folks out there in that 18 to 24 age group who would like to be vaccinated because they have some underlying condition that would predispose them to severe complications should they get COVID. So it's really important we get vaccine to them. As soon as we have enough, we will move to that level. Number two, if I work in a retail store classified as essential, such as pet store or hardware store, can I currently receive the vaccine? So essential has been defined, and it does not include pet store or hardware stores. But let me tell you who is eligible for vaccine at this time. So on the 8th of February, eligibility was extended to people 65 years or older, healthcare providers, including long-term care facilities, first responders, correctional officers, workers in these industries, food and agriculture, U.S. Postal Service, manufacturing, grocery stores, public transit, people who work in education, like teachers, support staff, community college, higher education, child care workers, and people who work in the judiciary system, so judges, attorneys, advocates, that sort of thing. So that is the list of people who are deemed essential and eligible for vaccination now. All right, number three. Will homebound patients be able to get the vaccine at home, and if so, when? And again, the truthful answer is I don't know when. This is a very important population to vaccinate. We realize the limitations of people who, are homebound for health reasons. They have healthcare workers coming into their home. They can't easily get out of their home to go receive, get a vaccine at a clinic or like through a drive-through or something like that. It will happen when the home health agencies are able to receive vaccine and then provide those vaccine to their patients. So again, we just have a severely limited supply of COVID vaccine right now. And we have a lot of providers across the state that have signed up to be COVID providers. I think there are more than 600 providers across the state of Alabama right now who would like to get COVID vaccine and give it to their patients, including home health agencies. But right now, the state is only receiving between 50 and 70,000 doses of COVID vaccine each week. All right, number five. What happens with unadministered or delayed doses? Are they still stored? So I think this question is getting at what if we have 10 doses to give at the end of the day and we only have 8 people that show up? Well, what we do is we take those two doses and we go find someone to give that vaccine to. So no doses go wasted. None are delayed per se. And once we open a vial of the current vaccines that are available, either the Pfizer or Moderna vaccine, they have to be used within a short period. So once we crack that vial open, nothing goes unused or unadministered. It's all used. All right, number 6, is it possible to volunteer or host vaccination clinics? If so, how? So we do have some processes set up to receive or volunteer help. There is, of course, a vetting process and some paperwork that has to be completed. And there is also a web survey that you can complete to identify yourself as a volunteer host site for vaccine clinics. So send an email to covid19@mchd.org and we will direct you to the proper location. So again, covid19@mchd.org, and let them know what you're interested in, and someone can email you the appropriate pathway for volunteering to assist us or for volunteering to host a vaccine clinic. We're really not able to continue extending our work out to people who want to host clinics because we're not getting any first dose vaccine. So the Mobile County Health Department has not received first dose vaccine in many, many weeks. We are not able to give first dose vaccine at our clinic location at the cruise terminal. And this has been a challenge in trying to get vaccine. So at this time, we're not able to partner with people who volunteer to host clinics because we just don't have the vaccine. But certainly you can complete the form and let us know, and we can have your name and contact information should things change in the future. All right. Number 7, someone asking about any details on possible Grand Bay clinics. So I believe there was a pharmacy in Grand Bay that was identified as having received some vaccine. I don't know how much, probably a very limited supply. But the best way to see where there are locations in Mobile County that have received vaccine is to go on the ADPH website, so alabamapublichealth.org. They have a COVID vaccine page, and you can navigate to the dashboard where they have a map that has a little heart over the location of everyone who's received at least some vaccine. And there you can see if there are any locations in Grand Bay that have vaccine and contact them directly. All right, number 8, more information on vaccine sites. The website now has a vaccine site locator. Yes, so as I just mentioned, at alabamapublichealth.gov, you can navigate to the COVID-19 vaccine dashboard hub, and it contains information there on how many doses have been administered in Alabama and also the locations that have received at least some COVID vaccine. Unfortunately, it doesn't say who's giving vaccine this week, but I think they're working towards that. So just check back frequently so you can get the most up-to-date information. And remember, for vaccine clinics administered through the Mobile County Health Department, you can visit our website at mchdcares.com or call us at 251-410-MCHD. And again, look for us on Facebook, YouTube, Instagram, and Twitter by searching I Love MCHD, all one word, I Love MCHD, and follow us there to stay up to date on the most current information that we're providing to the public. Thanks, everyone. We'll talk soon.